Hi, I'm Leesa Galatz, System Chair of Orthopedic Surgery at the Mount Sinai Health System. We're all getting ready to get outside and enjoy ourselves during the summer of 2020, so we have gathered some of our spine experts from the Spine Center in the Mount Sinai Health System to give you some exercises and tips and tricks on keeping a healthy back while you're getting fit summer of 2020.
Hi, my name is Dr. Eugene Bulkin. I'm one of the spine specialists at the Mount Sinai Spine Center in New York City, and today I will show you some stretching exercises that I usually recommend to my patients before they start working out. Okay, so one of the first things I do is gentle rotation. So for this, usually put your feet around the shoulder length apart and start gently rotating around your pelvis. Relax your arms. You can follow with your head as well to stretch down the muscles of your neck. Do it for about 30 seconds, and this will start warming up the muscles of the back and bring the blood supply to those muscles. Okay, next stretch is the stretch of hamstring muscles. Hamstring muscles are also very important to prevent back injury, because if your hamstrings, the back of the thighs, are tight, you can also injure your back. So for that, try not to bend forward from the waist. Try to keep your spine straight and go down on the hamstring so it stretches without you putting too much stress on the actual spine. Go down, hold for about 10 seconds, get up, change, go down on the other hamstring. You should feel the muscle on the back of the thigh stretching. Do it 3 times on each side. Okay, the next stretch I'll show you is the stretch of the hip flexor muscles. They're also important because they attach from the upper thigh to the back, and they're also prone to injury while you're exercising. So for this, same position, turn around and start bending the front knee while trying to stretch the front of the thigh. Here we go. Go down, hold about 10 seconds, go up, repeat on the other side. Go down so you feel the stretch for about 10 seconds. Do it 3 times on each side. One of the first stretches to start stretching your back, and the easiest one, is knees to the chest. For this, you lay down, relax your shoulders, neck, and head. Just grab both of your knees and gently start pulling them to the chest. Hold to about count of 10 and relax. And do it again and relax. You should feel some gentle warm sensation and stretch around the back muscles. Okay, next stretch is the piriformis muscle stretch. For this, you again lay down on your back, head and neck relaxed. Okay, you cross one leg over the other, grab the knee and try pulling it to the opposite shoulder. Okay, you should feel the stress around this area, around the piriformis muscle, which is also important to prevent low back injuries. Notice that your back is relaxed while you're doing it. You're just stretching this muscle. Okay, you change the position, left knee to the right shoulder, and hold it for about count of 10 and relax. And do it 3 times on each side. Okay, for the next stretch, I usually lay down, and I start with a very simple one. Laying down, relax your neck and head, feet together, and you just drop your knees to one side and feel the stretch on the opposite side of your body. And you do the same thing on the opposite side. Again, relax your neck, drop your head, feet together, and you drop your knees to the other side while stretching the muscles on the back here. Hold for about 10 seconds and relax. And the opposite side, count to 10 and relax. Try to do it 3 times on each side. Okay, the next stretch is called the prayer stretch. This stretches your lower back as well as some of the upper back. So for this, you just kneel down and reach forward with your arms and try to go down. Try to stretch the back, the upper back, the shoulders. Hold it for about 10 seconds and relax. Do it again. Don't hold your breath, keep breathing and relax, and do it 3 times. And this next stretch will bring your spine through the range of motion and prepare it for the workout. For this, get a stable base on all 4 and try to bend your spine, feel the muscles stretch, breathe, and gently extend your spine. Again, breathe. Again. Do it about 3 times, and it's a great stretch to begin before the exercises. I hope you enjoyed the stretches, and just to remind you, while you're doing them, try to stay safe. If you feel pain in your back, try to stop and don't push through pain.
Hi, my name is James Lynn, and I'm a spine surgeon at Mount Sinai Hospital. I hope you all are staying safe. I wanted to answer some of the common questions I get asked about lumbar radiculopathy, also commonly referred to as sciatica. In this presentation, I'm going to take you through 5 common questions patients often ask me. 1. What is sciatica? 2. What is a disc herniation? 3. Why does my leg hurt and not my back? 4. What treatments are available? And 5. Will I need surgery? What is sciatica? Sciatica, also known as lumbar radiculopathy, is the pain running down your leg that is caused by a pinched nerve in your lower back. This is usually caused by a disc herniation. What is a disc herniation? Your spine is composed of multiple blocks of bone, or vertebrae, with discs in between. The disc is like a jelly-filled tire that provides cushioning. As we get older, it can wear out or go flat, so to speak. However, instead of air coming out, the jelly inside herniates out. Think of this as a super hot Tabasco jelly. When it hits your nerves, it compresses them, and it also stings. Why do I have leg pain and not back pain? Many patients find this confusing. Although the disc herniation is in your back, the reason you feel pain is because it irritates nerves that travel from your back down to your leg. What is the treatment? There are a variety of treatments available, including anti-inflammatory medication, muscle relaxants, and even steroid injections. 80 to 90% of patients respond well to this, and over 2 to 3 months, your body will help resorb some of the herniated disc material and the pain will improve. Will I need surgery? Fortunately, the majority of patients do not need surgery. However, if you don't respond to non-surgical treatment over 6 to 12 weeks, you may be a candidate for surgery. Additionally, if you are experiencing bowel or bladder incontinence or severe muscle weakness, immediately contact your healthcare provider or go to your local emergency room for an urgent consultation. So to sum things up, sciatica is leg pain caused by a pinched nerve in your lower back, typically caused by a disc herniation. When the disc material herniates out, it irritates your lumbar nerves that travel down to your legs. This causes leg pain. Most people respond to conservative treatment with oral medications and sometimes a steroid injection. If you don't respond to non-surgical treatments after 6 to 12 weeks, you may be a candidate for surgery. If you have bowel or bladder incontinence or severe weakness, seek care immediately by contacting your healthcare provider or going to the local emergency room. Hopefully this answered some of the questions you may have, and please stay safe. Thank you.
Hello, my name is Dr. Saad Chaudhary. I'm a minimally invasive spine surgeon at the Mount Sinai Hospital in New York City. It is my task today to discuss neck pain and associated symptoms during the COVID pandemic. First and foremost, I'd like to wish you and your loved ones health and fortitude to get through this disorienting and challenging time. So, neck pain is very common, and you may ask, why am I having neck pain now? Well, it's important to know that up to 80% of American adults will experience some form of neck pain during their lifetime, and as many as 20% annually experience neck pain. What are some of the risk factors during the COVID-19 pandemic that may lead to neck pain? The first and most obvious one is stress. Needless to say, there's a lot of stress to go around, and most of us hold our stress in our trapezial muscles and the myofascial bands in the back of the neck, that can often result into localized neck pain or even suboccipital headaches. The second most common reason why during the COVID-19 pandemic there's an uptick in neck pain is most of us are working from home. And whether this is a specific spot within our houses or we're working off our couch and hopefully not our beds, we're spending extended period of time in an uncomfortable, non-ergonomic posture. Looking down at our screens or looking down at our tablets or smartphones, this can lead to stretching of the muscles and again, the fascial bands in the back of the neck that increases pain and tension. Another reason why we can be having more neck pain during this time is poor sleep. A combination of stress, anxiety, bad work environment, as well as poor sleep is a perfect trifecta to have inflammation and ongoing neck pain. Lastly, loss of exercise or activity is a very common reason for many musculoskeletal orthopedic conditions, including neck pain. And that's because the gyms are closed. You may not be able to go outside to the parks and get your daily routine walk to work or other forms of physical activity. And now those muscles are getting no activity at all and are causing atrophy and more pain there. Alternatively, some of us may have started a new workout routine and that could have started an inflammatory process. So there's many reasons why there's an increased uptick in neck pain. Neck pain can be caused by several anatomic structural issues or other physiologic problems within the neck. It's important to understand that the neck serves as an important structure that protects the spinal cord and the nerves leaving the neck, but it also balances our head so that we can have a nice, soft, and smooth range of motion during the daily activities that we perform. So if any of those structures, including the muscles, ligaments, or discs, are damaged or inflamed, that can cause a variety of symptoms, most specifically neck pain for many, but it can also cause arm symptoms or other symptoms. The most common etiology or disease states that produce neck pain are degenerative or arthritic by condition. However, it's important to know that trauma, history of a recent infection, cancer, and other inflammatory conditions can also result in neck pain. So it is important to keep those in your mind, and if you're speaking to a healthcare provider, make sure to include that as part of your history. For the purposes of this webinar, we're going to focus mostly on the common degenerative conditions that lead to neck pain. So the degenerative conditions that cause neck pain can also cause stiffness and loss of range of motion or painful range of motion. Some of the other symptoms that one might experience is weakness, numbness, tingling, or other symptoms that are not just localized to the neck, but they go into the shoulder blade or down the arm, or as I mentioned before, can also cause cervicogenic headaches. It's important to also pay attention to your hand function if you're feeling that you're dropping things from your hands easily, getting more clumsy, or losing your balance. Those are more ominous symptoms and certainly require a consultation with a spinal specialist. What can you do at home if you're starting to experience neck pain? So initially, I would recommend taking a step back from certain activities. If you had started doing some new activities, step back and take some time, some rest. Other things you can try is heat or ice. In the initial 24 to 48 hours after the onset of symptoms, I recommend applying ice to the affected area. Generally, you want to apply ice for about 20 minutes to that zone every 3 to 4 hours. And after the first 24 to 48 hours, if you choose, you can also use heat. Or some people alternate between heat and ice and they find that to be quite comforting. There's also over-the-counter medications that are available to help. And most common ones are Tylenol or acetaminophen. Or if you don't have a kidney issue or history of ulcers or heartburn, you can try an anti-inflammatory medication such as Aleve, Advil, naproxen, and the like. Those are quite helpful for these inflammatory conditions. If despite doing the above, you're still having ongoing symptoms, it is important to contact a healthcare provider. Myself and my colleagues at the Mount Sinai Spine Center are available for virtual visits as well as in-person visits if your symptoms require that. It's important to know that you don't have to suffer through the pain in isolation and by yourself at home. You can reach out very easily from the comfort of your home to get an expert opinion. And we may choose to include steroids or other forms of medication to your regimen, or prescribe therapy or other treatments that can be very beneficial. So now let's talk about when is it essential or quite important to go seek out a healthcare professional or a spinal specialist. Well, if you're having persistent or progressive pain that haven't improved by doing the rest, ice, heat, or over-the-counter medication, you should call one of us for a visit. Moreover, if you're having symptoms that are not just localized to neck pain, but are having weakness or pain, numbness, tingling going down the arm, or there's any history of loss of balance, worsening clumsiness, that should prompt a call to a healthcare provider. Also, certain patients with history of cancers, recent infections, or if you're having night pain or had a significant trauma, you should not wait and just contact your healthcare provider, as there could be an underlying condition that needs to be evaluated. I would be remiss if I didn't discuss any preventative techniques during this webinar. So the things that we talked about so far were reactionary. So if you've already had neck pain, what can you do? But I offer this to all of my patients. It's always good to take some preventative measures to avoid either an episode or ongoing episodes of neck or other spinal problems. So we can improve our postural techniques. And again, especially during the COVID-19 pandemic, many of us are working from home. Try not to sit in a slouched position. Don't look down at our smart devices. That tech neck concept holds true during this time. Try to keep your workstations right at eye level if you're working. Try to sit upright and try to incorporate frequent breaks during your routine. You might have the benefit of trying to take a few minutes every 2 to 3 hours to get up and stretch. If you're sitting for long periods of time, try to do some work standing up. And it's also important to improve our sleep hygiene and sleep posture. So if you're a back sleeper, make sure you're not sleeping on a mountain of pillows. Use one pillow that's well-fitting and supports the back of your neck and head while keeping the neck in line. Similarly, if you're a side sleeper, make sure your pillow accounts for your shoulder mass and you're not keeping your neck canted on one level or the other. If you're using too many pillows, that can happen. Certainly, if you're experiencing a lot of neck pain, I do not recommend that you sleep prone or you sleep on your belly, because that forces your neck in one or the other extreme, and that by the morning time can cause more inflammation to the joints and the muscles in the back of the neck. Top 3 exercises that I recommend for patients with neck pain and associated symptoms are called chin tuck, the first one. It's a simple exercise you can do at home, and you can do it laying flat or supine. Put a small rolled towel in the back of the neck, and it's not a big range of motion. All you're doing is bringing your chin backwards and holding that pose for about 5 to 10 seconds. Do about 10 of those exercises, and that helps strengthen the muscles in the back of the neck. The other 2 exercises I recommend focuses on the shoulder blades and the base of the spine. One of them is called shoulder or scapular retraction. The shoulder blades need to be squeezed to the side, and you can do that very easily by bringing your palms facing the wall opposite where you're sitting and squeeze your shoulders back together. And again, hold that pose for about 5 seconds and do a few of those, and that can generally strengthen the base of your neck. Similarly, the last exercise is called a corner exercise, and you can easily find these online, or feel free to call my office and we can give you further details. And that exercise can be done at a corner where you're resting your arm on one of the corners of the room and similarly bringing your shoulder blades backwards to stretch the shoulder blades. And that can be very helpful. So, some final thoughts. Good news is most people with neck pain tend to improve with heat, ice, and anti-inflammatory medications, and they go back to their normal level of activity. Avoid poor posture and poor sleep, and incorporate weekly, if not daily, stretches and strengthening exercises to your life. And that'll improve the chances that you won't be having more symptoms in the future. And lastly, if your pain is not just focused and localized to the neck, but you're having accompanying pain shooting down the arm with weakness, numbness, or other neurologic symptoms, contact a healthcare provider, and you don't have to suffer through this by yourself at home in isolation. I'd like to thank you for your time over the last few minutes. It was my pleasure to spend some time with you during this webinar. I do hope I answered some of your questions and concerns surrounding neck pain and associated symptoms. And finally, I wish you and your loved ones health and safety throughout the next few months of this ongoing pandemic and this turbulent time. Be well.
Hello, today we're here to talk about posture in the home workplace and neck exercises and fitness of your upper body. So it's very apparent that people in the COVID-19 era and coronavirus era are working from home and often are working on a laptop computer at a desk site, or sometimes sitting on a sofa or a chair and working on their laptop computer. So it's really important in order to avoid neck pain or shoulder blade pain or headaches to work with appropriate posture. So the best way to do that is to work with an upright chair with a rigid back and make sure that your shoulder blades are touching the back of the chair like mine are, as well as not getting sucked in, so to speak, to leaning into the computer like this. This would be a very bad way to sit and look at the computer. So the best things to do are to have make sure that your eyesight is such that you can read the computer screen and the size of the font from a distance, but also make sure that you have a computer that is at a comfortable level. If you find that it's too difficult for you to do that, one of the things you can do is have your screen up and using that keyboard that you can attach to your computer or use a wireless one. It's just going to promote better posture, and you're going to see better, and you're going to be much more comfortable because the weight of your head is going to be axially directly over your shoulders, and it's not going to be forward where you have to use your musculature to hold it up. So that's just some simple tips on what you can do at home to make yourself more comfortable. Again, a chair that doesn't recline will also allow your shoulders to lean back against the back of the chair, and that'll be helpful. So one of the things you can do when you are feeling some pain in your neck and your shoulders and your shoulder blades is you could try to do some home exercise. So the first thing you could do, stand with your legs shoulder length apart and just with your posture and chest up, and with your good posture, just rotate your arms back and forth and loosen up a little bit. And do that for about 20 seconds. I'm not going to do it for the full 20 seconds. And just let your arms loosen up the muscles in your body. So one of the exercises that you can do is called a chin tuck. So what you would do is you literally will bring your chin back and bring the back of your skull a little upwards. And this motion, and count to 3. And when you're done, you go to rest. You do not bring your head forward. You just go from rest, back and up. And you would do that about 10 times. So that helps with strength, but it also helps to stretch out some of the muscles in the back of your neck. And it also helps to open up your spinal canal. And you would do about 10 of those, 3 seconds each, for a total of about 30 seconds. The next thing you can do is just, I'll do it standing from the side so you can see, is take some deep breaths by lifting up your chest and holding your chest so your head lays directly over your trapezius and your chest is upward and outward, and just take some deep breaths and release the tension from those muscles. Third thing you're going to do is you're going to do 30 backward shoulder rolls by lifting your shoulder blades as high as you can, rolling them backwards and coming down and around. So that's up, back, down and around. Do it from the side. That's up, back, down and around. That's up, back, down and around. So I'm not going to do that 30 times, but that would be the recommended amount. Next thing I'm going to do is a stretch of the rhomboid muscles, which are the muscles that attach the shoulder blade to the spinous processes in the mid-thoracic region. So I'm going to show that from the side. You're going to hold your arms at 90 degrees, so your arm is up at 90 degrees. A right angle between your body and your arm. You're going to clasp one hand in front of the other, and you're not going to bob your head forward because that's going to bother your neck. You're literally going to try to press your arms forward. Hold that for about 10 seconds and rest. And you're going to repeat that 3 times. That'll stretch some of the muscles in your shoulder blade area on the inner aspect and release some of those muscles. Similarly, stretching some of the other muscles of your shoulder blade, but more the upper ones, is the kind of opposite move. You're going to bring your one hand in the other, it doesn't matter which. You're going to hold one hand in the other. You're going to squeeze your shoulder blades together and reach for the floor and hold that for about 10 seconds. And the last exercise that I would recommend is just a side bending exercise. The safest way to do that, a lot of people will do that by holding the top of their head, but the safest way to do that is if you put your fingers in the musculature just below where the skull ends and the muscle belly just below and behind your ears, and bend your head to the opposite side, about 20 to 30 degrees at most, just so you feel the muscle stretching. And you could use your fingertips to pull up on the muscle. That's the best way to do that exercise. The last thing I would recommend is just going through a gentle rolling of your neck, just to the point where you might feel some discomfort. You don't have to push it. And just do that about 5 times to each direction. And that's pretty much the mainstay of the exercise program. I would tell every person who's going to consider doing this, if at any point it aggravates your pain, not for a second or two while you're doing it, but afterwards your condition feels like it's worsening, not to do it. If during the exercises you get any lightheadedness or dizziness, you shouldn't repeat it and you should call a physician. And if you know for a fact that any doctor in the past has ever told you you have any spinal cord compression on your spine from previous x-rays or MRIs, then you shouldn't be doing these exercises. I thank you for your time and I wish you wellness and safety.
Thanks for tuning into our webinar, Staying Safe in the Time of Shelter at Home. We hope we've been able to provide some useful information and tips that you can use in the coming weeks. Here is information on accessing our orthopedic physicians and surgeons. In the meantime, stay safe and stay healthy.